New York City.
Yeah.
So why are we here? What are we doing here right now?
Well, we're really here to talk about Mommy Makeover and Itsmyturn.com,
Okay.
which is a wonderful program, educational program for patients talking about the different options in terms of rejuvenating their body, maybe after having kids or just getting a little bit older, really from head to toe. Not only surgery and surgical options for breast enhancement, maybe tummy tuck, but also Botox cosmetic for softening lines and wrinkles on the face, and also for facial fillers and rejuvenation treatments such as that.
Okay, so I'm a mom, and I had my C-section 11 years ago, and I've done everything to, what they say, go to the gym, eat right. I'm a vegetarian. I do everything. I don't smoke, I don't drink, and I cannot get rid of my pouch by my stomach. And you can see I'm wearing this dress, and I'm not wearing any Spanx. And I seriously work out constantly. Like, it's disgusting. Like, I'm and see this? You can zoom in over here. I can't get rid of this. I'm sure I'm like many moms that cannot get rid of this. And this is so for all those moms that are like, they just had their baby, what would you recommend, with Allergan, for the tummy issues, especially those that have C-section? Because after my first daughter that I had regular without, vaginal delivery, I had no problems. My stomach went right back. It was like I never had a baby. And the C-section just ruined me. So what are you, I love you, honey. I love you, 11-year-old, but you ruined my body. So
well, these are very common concerns that I see in my patients. A lot of women who've had their kids. Right. And typically we recommend maybe about at least a year after your last child. So
definitely wait a year and like do all the diet and all that stuff.
All that stuff. But inevitably there's some changes that just make patients feel uncomfortable, as you described, how you fit in your clothes. Exactly. Maybe your breasts are a little bit saggy and droopy.
Right.
Yeah, a lot of patients feel uncomfortable. After breastfeeding, they feel
I've heard horror stories. I wasn't able to breastfeed, so it didn't really apply to me, but I've seen. Yeah.
Well, I think
I'm shouting at my sisters right now who I love them, but she just breastfed her 4th kid and she's ready.
Well, there's definitely, there are those circumstances that the patients feel uncomfortable, maybe wearing a bathing suit, things of that nature. They've lost a little bit of fullness up in the upper pole. But there are great options to correct a lot of those types of issues.
Okay, so tell me the options for the tummy and for the breasts.
Sure. So for the tummy, very commonly we may remove a little bit of extra skin, tighten the muscles, and I think it's important to remember that, as you described, there are a lot of women who've done lots of exercises.
Right. There are some things isn't it true? There are some things that no matter how much exercise you do, and the diet, either it's genetics or the C-section, it's just not. It's not right. Right. People are like, oh, you're just obviously not eating. Now you have to go vegan. You have to go raw. That's the reason why you're carrying dairy in your belly.
Yeah, there's some things that only surgery can address, and I think part of this is helping patients understand their options and going to a board-certified surgeon and talking about them and finding out about these different choices and options available to help them. But for the tummy, it's maybe removing a little bit of skin, tightening the muscle. Okay. For the breast, it might be restoring more youthful volume with a silicone gel implant, maybe sculpting a little bit of the skin. All of those types of things are a possibility. And then for the face, softening the lines and wrinkles is a really nice way to kind of segue into this area of rejuvenation. Right. And the fillers as well from the Juvederm suite of different products, either in the cheeks or in the nasolabial folds, in those areas, or even in the lips, can be really great for patients.
Now, you were talking about a site, It's Itsmyturn.com.
Itsmyturn.com.
So tell us about that.
So Itsmyturn.com is a great website, really comprehensive in terms of giving patients different options and choices regarding some of the changes that their body has experienced and how they can best address them. From breast implants and the trial implants to Botox cosmetic and the fillers that we talked about to other surgical procedures, and really some of the information about what's involved, how to best go about taking the next steps. There's a Find a Doctor section on that website as well, and it's a really great, wonderful site for patients to start out.
Do you feel like it's trying to, the reason you did this site was to sort of demystify all this secrecy around women wanting to, improve their bodies and not make it, and that it's not, just the, it's not just for people that are really, well off, that it's for everyone. Yeah. You can find, there are procedures you can do, whether it's they're invasive or just,
minimally invasive.
Minimally invasive, right.
Yeah, exactly. I think that the part of this campaign is really focused on changing that whole perception of who the plastic surgery patient is really.
Right.
You know, what the perception of is in the media may not necessarily, really what I see in my practice is not the reality. I'm seeing moms like you every day coming in with very common complaints that we talked about in terms of just not feeling comfortable with themselves, changes that they can't reverse with diet and exercise. They're very frustrated. And this is all about really returning it, you know, and giving something back to themselves.
It's a little bit like power. It's a little empowering. It
is, absolutely. And helping them ultimately feel good about the choices that they've made, having a great conversation with a board-certified surgeon that gives them the information to make an informed decision that may be right for them.
So if you had to say, you know, your top like 3 tips for women who are looking at the site, Itsmyturn.com, go on there, and what would you say are like your advice for women that are like, they're ready, they feel like they're ready, but they're afraid, and or they feel like it's, you know, it's selfish, it's silly, my wrinkles are, you know, my wrinkles, my body, it's proof of that I've lived a life, and you know, what do you say to those women? What is your advice for them, and why should they just at least go to the site?
Yeah.
Just go to the site.
I think the main component is really when you invest in yourself, you know, and you feel better about yourself, and you take the time and the energy. You know, so many of these women have given so much back to their families.
Right.
You know, and the focus has not been on themselves, and they've been very selfless, you know, and certainly not selfish. It's an opportunity, really. The whole point of it is Itsmyturn.com, really to kind of bring it back to themselves and to really reinvest in themselves, because then they can actually take better care of their families when they feel good and confident. On that site, I think first and foremost, really do your research, educate yourself, find a great board certified surgeon who's going to be able to use this suite of great Allergan products, from the Lehfeldt Inspira implants to the Botox cosmetic to the Juvederm.
Wow, so those are all part of this family. I didn't even realize
Absolutely.
that.
Yeah, it's a comprehensive suite, and that's the other thing that's great about this this approach, is that it's really it covers every aspect of aging.
Yes, you know? It really does. So wait, tell me about these. What kind of breast implants are they?
So this is the Lehfeldt Inspira silicone gel implants. There's also saline implants available. These are fully FDA approved breast implants that have been heavily studied. They're very safe. They provide great service for patients. They're a highly cohesive implant, which means that they have less issues in terms of any contour issues. And they look fabulous for patients, and patients really appreciate them. And there's some additional technologies, such as the shaped anatomical implant, which can be wonderfully customized for patients. They're great. I really like Allergan products, most notably because they're such incredible options for patients. They have the most comprehensive suite to really customize the shape and the size that's perfect for your body from a biodimensional standpoint. We also have 3D imaging in the consultation to really demystify that process for patients.
So you can actually see what it's going to look like before.
See your afters before is what we call it.
Okay, that is truly groundbreaking.
Yeah, it's wonderful preparations, because again, it gives them a sense of what it's going to be like. It facilitates the conversation between the doctor, which I think is absolutely critical. You want to be on the same page, and really you want to be make sure that they share your vision. I think that's absolutely important, to have a great positive experience with either surgery or even the injectables and non-surgical treatments.
And then you said, so there's the breast implants, and then the Botox, which is for, you know, it's pretty non-invasive, just
fine lines and wrinkles. It really makes a big difference in terms of helping patients, you know, look more well rested. And you know, these little fine lines and lots of heavy expressions sometimes can make patients look a little more tired, a little more angry than they actually feel. And using Botox cosmetic can really help with some of those fine lines, and patients just say, you know, like, I look better, I look more rested.
Right. Like, you don't want to. You're not looking like the doctor should know like that the patient doesn't want to look like a different person. They just want to look like a better version of themselves.
Exactly.
More softer. You know, fresher version of themselves. And the last thing was Juvederm, you said, right?
Yeah. So Juvederm, they're a wonderful suite of fillers. Juvederm Ultra, Ultra Plus, and Voluma. And these are different types of fillers for different locations in the face. And really what they're focused on is restoring more youthful volume. You know, when we're younger, we have more of a heart-shaped face. And then as we get a little bit older, a little more tired, a little more worn down, where it's all happening to everybody. And there are a lot of moms out there that know exactly what I'm talking about.
Yeah, well, especially, you know, by the lip area, you get these little fine lines.
There's all sorts of different indications for these types of products, and And they're wonderful because patients can come in and in just a few minutes you can see the results right away.
Wow.
And they can be very lasting depending on what we're using and where it's going. It can last up to 2 years.
Wow.
So there's some great longevity and unbelievably high patient satisfaction with very low risk and low downside.
Okay, well, thank you so much for your time. Everyone go check out the site, itsmyturn.com, and thanks so much for watching.
Thank you.